Have you ever found yourself standing in the middle of a room, completely blanking on why you went in there? Or perhaps you felt a flash of panic when a familiar name suddenly escapes you. You might dismiss it as a senior moment, a normal part of getting older. But what if these moments are becoming more frequent? What if they're accompanied by a persistent feeling of worry or anxiety that you just can't shake? If this sounds familiar, you're in the right place. We're going to explore the critical difference between normal aging and signs that warrant a conversation with your doctor. This video is for anyone who has felt that flicker of concern about their memory, for those who are noticing a new and unwelcome anxiety tied to these changes, and for the caring family members who want to understand and provide support. We will delve into the science connecting memory and anxiety, outline what is and isn't a normal part of aging, and, most importantly, provide you with an extensive toolkit of practical, science-backed strategies to support your brain health and calm your mind. We will also guide you on how to have a clear and productive conversation with your doctor about your concerns. Understanding the crossroads of memory and anxiety. To begin, let's demystify what's happening in the brain. It is an undeniable fact that our brains change as we age. This is a natural biological process. For many, this means it might take a bit longer to learn a new skill, or you might need a moment longer to recall a piece of information. You might occasionally misplace your glasses or forget an appointment you made last week. This is often referred to as age-associated memory impairment and is generally not a cause for alarm. Your short-term memory might not be as sharp as it was in your 20s, but your long-term memory, skills, and knowledge often remain stable or can even improve. However, certain signs fall outside the scope of typical aging. These are the red flags that signal it's time to seek a professional opinion. These include significant and frequent memory loss. This isn't about forgetting where you put your keys. It's about forgetting recent, important events or conversations, or asking the same questions repeatedly. Difficulty with problem solving and planning. A noticeable new struggle with managing finances, following a familiar recipe, or keeping track of monthly bills. Confusion with time or place. Getting lost in a familiar neighborhood or feeling disoriented about the current date, season, or year. Challenges with visual or spatial information. New difficulty with balance, judging distances, or interpreting visual images, which can affect driving. Problems with language, frequently struggling to find the right words, calling things by the wrong name, or having trouble following a conversation. Withdrawal and personality changes. A marked shift in mood, such as new onset depression, apathy, or suspicion. Pulling away from social activities and hobbies that were once enjoyed. These more pronounced symptoms could indicate a condition known as mild cognitive impairment, or MCI. With MCI, the cognitive changes are noticeable to the individual and sometimes their family, but they are not yet severe enough to significantly interfere with daily independence. It is critical to identify MCI because while some individuals with MCI will progress to more serious conditions, like Alzheimer's disease, many will not. In some cases, MCI can even be reversed if it's caused by an underlying, treatable issue. Now let's introduce anxiety into this equation. Anxiety is not simply stress. It's a state of persistent, excessive worry that can feel all-consuming. The relationship between anxiety and memory is a powerful two-way street. Here is the science behind it. When you are chronically anxious, your body is perpetually in a fight-or-flight mode. This state triggers the release of stress hormones, most notably cortisol. While cortisol is useful in short bursts, chronically elevated levels are toxic to the brain. High cortisol can damage and shrink the hippocampus, a seahorse-shaped structure deep in your brain that plays a pivotal role in forming new memories and retrieving existing ones. Simultaneously, chronic anxiety keeps your brain's fear center, the amygdala, on high alert. This overactive amygdala sends constant alarm signals, while the prefrontal cortex, the part of your brain responsible for rational thought, focus, and decision-making, becomes less effective at calming those alarms. Your brain's cognitive resources are essentially hijacked by worry, leaving less bandwidth for everyday tasks like remembering your grocery list or where you parked your car. This creates a debilitating cycle. You have a minor memory lapse, which triggers anxiety about your cognitive health. That anxiety then floods your brain with cortisol, making it even harder to focus and remember things. This in turn provides more evidence for your anxious brain that something is wrong, leading to even more anxiety. It is a self-perpetuating loop. Research has shown that late-life anxiety can be a significant risk factor for cognitive decline, making it crucial to address both issues head-on. Actionable solutions and strategies. Understanding the intricate connection between your mind and brain is the first step. Now we move to the most important part, empowering you with actionable strategies to break the cycle, support your brain, and reclaim your peace of mind. Strategy 1. Fortify your brain with a healthy lifestyle. Your daily habits are the bedrock of your cognitive health. Decades of research have unequivocally shown that lifestyle is a powerful lever we can pull to protect our brains. This involves making conscious, daily choices regarding diet, exercise, and sleep that directly nourish and protect your brain. The science. A healthy lifestyle combats the primary enemies of the aging brain: inflammation, oxidative stress, and reduced blood flow. It promotes the growth of new neurons and connections, a process known as neuroplasticity, building a more resilient brain. How to do it? Adopt the Mind Diet. This diet, a hybrid of the Mediterranean and DASH diets, was specifically developed to support cognitive function. Embrace these foods: leafy greens, kale, spinach. At least 6 servings per week. They are packed with brain-protective nutrients like folate, vitamin E, and carotenoids. Berries, blueberries, strawberries. At least 2 servings per week. Their high flavonoid content helps reduce inflammation and improve cell signaling. Nuts, walnuts, almonds. 5 servings per week. They are great sources of healthy fats, antioxidants, and vitamin E. Olive oil. Use it as your primary cooking oil. It's a powerful anti-inflammatory agent. Whole grains, fish, especially fatty fish like salmon, beans, and poultry. Limit these foods. Reduce your intake of red meat, butter, cheese, sweets, and fried or fast foods, as they can promote inflammation. Commit to regular physical activity. Exercise is arguably the single most effective action you can take for your brain. Aerobic exercise, brisk walking, swimming, cycling, or dancing for at least 150 minutes per week increases blood flow, delivering more oxygen and nutrients to the brain. It has been shown to increase the size of the hippocampus. Strength training. Lifting weights or using resistance bands twice a week helps regulate hormones and improves metabolic health, which is tied to brain health. Balance and coordination. Activities like Tai Chi or yoga are excellent for improving balance, which can reduce the risk of falls, a major source of anxiety for many seniors. Prioritize restorative sleep. Sleep is your brain's nightly cleaning and maintenance crew. The process. During deep sleep, your brain consolidates memories, transferring them from short-term to long-term storage. It also activates a waste-clearing system that flushes out toxins, including beta-amyloid plaques associated with Alzheimer's. Sleep hygiene tips. Stick to a consistent sleep schedule, even on weekends. Create a relaxing pre-sleep routine, e.g., reading a book, taking a warm bath, listening to calm music. Ensure your bedroom is dark, quiet, and cool. Avoid caffeine and alcohol in the hours before bed. Turn off screens, TVs, phones, tablets, at least an hour before sleep, as the blue light can disrupt your natural sleep-wake cycle. Strategy 2. Calm the anxious mind with mindfulness. To effectively address memory, you must first address the anxiety that clouds it. Mindfulness practices are scientifically validated tools for calming a hyperactive nervous system. What it is? Mindfulness is the practice of paying attention to the present moment on purpose, without judgment. It's about observing your thoughts and feelings without getting carried away by them. The science techniques like deep, controlled breathing activate the vagus nerve, which engages the parasympathetic nervous system, your body's rest and digest system. This slows your heart rate, lowers blood pressure, and reduces cortisol levels, creating a biological state of calm that allows your prefrontal cortex to come back online. How to do it? Box breathing. A simple, powerful technique used by everyone from Navy SEALs to surgeons to manage stress. Sit in a comfortable chair with your feet on the floor. Slowly exhale all the air from your lungs. Inhale slowly through your nose for a count of 4. Hold your breath for a count of 4. Exhale slowly through your mouth for a count of 4. Hold the exhale for a count of 4. Repeat this cycle for 5 to 10 repetitions, focusing on the sensation of the breath. The 5-4-3-2-1 grounding technique, an excellent tool to use when you feel a wave of anxiety or panic. It forces your brain to focus on the present moment through your senses. Pause and look around you. Acknowledge 5 things you can see. Notice their color, shape, and texture. Acknowledge 4 things you can feel: the chair beneath you, your feet on the floor, the fabric of your clothes. Acknowledge 3 things you can hear: the hum of a fan, a distant siren, your own breathing. Acknowledge 2 things you can smell: the scent of coffee, the clean laundry, or just the air in the room. Acknowledge 1 thing you can taste. Take a sip of water or simply notice the taste in your mouth. Bonus tip: the mindful body scan. This practice helps you reconnect with your body and release physical tension you might not even be aware you're holding. Lie down comfortably on your back. Close your eyes and bring your attention to your toes. Notice any sensations: warmth, coolness, tingling, without judging them. Slowly move your attention up through your feet, to your ankles, your calves, your knees, and so on, methodically scanning your entire body. As you focus on each part, consciously try to relax and release any tension you find. This can be done for 5 to 20 minutes and is an excellent practice before sleep. Strategy 3. Actively engage your brain. The concept of use it or lose it is a well-established principle in neuroscience. Challenging your brain builds resilience and what scientists call cognitive reserve. Purposefully engaging in novel and mentally stimulating activities that push you out of your cognitive comfort zone. The science: learning new things creates new neural pathways and strengthens existing ones. A higher cognitive reserve is like having a bigger, more efficient brain engine, which may help you compensate for age-related changes and better withstand neurological challenges. How to do it? Learn something new. The novelty is key. Try learning a musical instrument, a new language using a phone app, or take an online course on a topic that fascinates you, like history or astronomy. Play strategy games. Move beyond simple games. Chess, bridge, Sudoku, and complex crossword puzzles require planning, strategy, and memory, providing a robust mental workout. Read widely and deeply. Don't just stick to your favorite genre. Pick up a nonfiction book on a new subject. Read articles that challenge your perspective. Afterward, try to summarize the main points to a friend. This reinforces learning. Break your routine. Simple changes can stimulate your brain. Take a different route on your daily walk. Try brushing your teeth with your non-dominant hand, or rearrange your kitchen drawers and force yourself to remember where things are. Strategy 4. Implement memory support systems. This strategy is about reducing the cognitive load on your brain, which in turn reduces the anxiety associated with the fear of forgetting. Using external tools and routines to organize your life and offload the burden of remembering everything. The science. Your brain has a limited amount of working memory, like a computer's RAM. By using external aids, you free up that mental workspace for more complex thinking and problem solving, rather than using it to remember to take your pills or buy milk. How to do it: a home for everything. Designate a specific spot for essential items. Your keys always go in a bowl by the door. Your glasses are always on the nightstand. Your wallet is always in your purse. Be disciplined about this. Use calendars and planners. Use a large wall calendar for appointments, birthdays, and important dates. A daily planner can help you structure your day and provides a sense of accomplishment as you check items off. Embrace technology, if comfortable. Set alarms and reminders on your smartphone for appointments and medications. Use a digital notes app to jot down grocery lists or thoughts. Pill organizers. A weekly pill organizer is non-negotiable for managing medications. It removes the daily worry of, "Did I take my pill this morning?" Say it aloud. When you do something important, verbalize it. As you turn off the stove, say, I am turning off the stove now. As you lock the door, say, the door is now locked. This engages multiple senses and reinforces the memory. Do's and don'ts for brain health and anxiety. Here is a clear, easy-to-follow summary of helpful behaviors and common pitfalls. DO, stay socially connected. Schedule regular calls with family, join a book club, or volunteer. Socializing is a potent form of mental stimulation. Don't. Isolate yourself. Loneliness is a significant risk factor for both depression and cognitive decline. DO, prioritize your sleep. Treat it with the same importance as diet and exercise. Don't. Use alcohol or excessive television to manage anxiety or boredom. Alcohol disrupts sleep architecture, and passive TV viewing is not a brain-building activity. Do. Challenge your mind every single day, even in small ways. Don't. Fall into the trap of believing all memory lapses are an inevitable and untreatable part of aging. DO. Be proactive and speak to your doctor if you are concerned. Early assessment is always the best course of action. Don't. Wait for a crisis. It is far better to have your concerns addressed early and find they are nothing to worry about than to ignore a potentially serious issue. Information on professional treatment and medication. If you and your doctor decide that intervention is necessary, it is helpful to understand the landscape of potential treatments. This information is purely educational to help you have an informed discussion. Therapeutic approaches. For anxiety, the gold standard is often cognitive behavioral therapy, CBT. CBT is a practical, goal-oriented therapy that helps you identify, challenge, and reframe the negative thought patterns that drive anxiety. For instance, you would learn to challenge the thought, I forgot a name, so I must be getting Alzheimer's, and replace it with a more balanced thought like, forgetting a name is common, and I have many other strengths. Medication. A doctor might discuss medications. For anxiety, this could include antidepressants like SSRIs, which can be very effective and are generally well tolerated in older adults. For diagnosed cognitive conditions, there are specific medications designed to manage symptoms. It is absolutely essential that any discussion about medication is had with your doctor, who can assess your overall health, other medications, and potential side effects. Precautions and potential dangers. Ignoring significant changes in your memory and anxiety can have serious consequences. Chronic unmanaged anxiety does more than just make you feel bad. Clinical research shows it can lead to long-term structural changes in the brain, potentially accelerating brain aging. Leaving these conditions unaddressed can erode your confidence, strain relationships with loved ones who may not understand the changes they are seeing, and ultimately impact your ability to live an independent, fulfilling life. The most significant danger is missing the opportunity for early diagnosis and intervention for a treatable underlying condition. How to make it a sustainable habit. Knowing what to do is one thing. Integrating it into your daily life is the real challenge. Here is a guide to making these strategies stick. Start small. Do not try to change everything at once. Choose one single thing to focus on for the first week. Maybe it's a 10-minute walk after lunch or practicing box breathing for 2 minutes each morning. Anchor to existing routines. Link your new habit to an established one. For example, after I brush my teeth in the morning, I will do one Sudoku puzzle. This habit stacking makes the new behavior feel more automatic. Track your progress. Get a calendar and put a simple X on each day you complete your new habit. This visual proof of your consistency is a powerful motivator. Find social support. Tell a friend or family member about your goal. This accountability can make a huge difference. Better yet, find someone to do it with you, like a walking partner. Practice self-compassion. You will have days where you lack motivation or forget your new routine. This is normal. The goal is not perfection. It is consistent effort over time. If you miss a day, simply begin again the next day without judgment or guilt. Conclusion. We have established that while some degree of forgetfulness can be a normal part of the aging journey, persistent memory loss, especially when intertwined with anxiety, is a clear signal from your body and brain to seek clarity. You have learned how a healthy lifestyle, mindfulness practices, cognitive engagement, and organizational strategies form a powerful defense for your brain health. The most critical takeaway is to feel empowered. You are the expert on your own body and mind. If you feel that something is not right, trust that feeling. Your brain has a remarkable capacity for resilience and adaptation. By taking these small, consistent steps, you are not just hoping for a better future, you are actively building one. If this video was helpful, please give it a like and consider subscribing to Mental Wellness Insight for more doctor-approved wellness tips. Sharing this video with someone you care about could be the encouragement they need. We would love to hear from you in the comments. Which one of these techniques will you try first? Thank you for investing this time in your well-being. Disclaimer. This video is for educational and informational purposes only. The information we're sharing is designed to support, not replace, the relationship that exists between you and your healthcare provider.